On my go, you're gonna give me 1, 2, 3. As fast as you can. Ready? Go. Good. Go. 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 Relax.
It's more than just go, go, go at the University of Kansas Health System Sports Medicine and Performance Center. Young athletes are training their bodies and their minds for what's next. Good morning, I'm Alexis Del Cid. Welcome to the Morning Medical Update. As parents, of course, we want our kids to be safe and healthy. It's also the same goal for the trainers at the Health System Sports Medicine and Performance Center, giving these young athletes the tools to reach for their dreams while helping them condition their bodies to avoid injury. Janine Kiesling shows us.
Go!
It's more than just sweat and reps.
Go!
It's preparation, passion,
Go!
and performance.
Go!
At the University of Kansas Health System Sports Medicine and Performance Center,
Fall into it.
student athletes
Hips
are
are
training
extended.
for more than just the next game. St. Thomas Aquinas Jr. Layla Bolin is coming off a state championship basketball season.
I want to see about 3 good reps here.
She credits this 10-week
hurting,
summer
Layla?
program for sharpening both her mind and her body.
If you don't have that mental fitness, you're not really gonna make it that far. It takes a lot and it's hard, but you just gotta push through it.
Layla trains with performance coach Mariah Elmore.
Slightly back a little bit more.
She says the mental conditioning is just as tough
Go.
and just as important.
Just to strengthen and work on my agility and quickness and stuff, and they've actually been paying off.
Go.
On the turf, St. Thomas Aquinas senior Max Mansky is gearing up for his final high school football season.
Go.
Like Layla,
Good job.
he's coming off a state championship. And like her, he's seeing the results of this program.
I think without this, I don't know if I would have even have started last year.
Wow.
I think it's done a lot.
And go.
Max has been training with the Health System's Sports Medicine and Performance team since he was little
We can sleep in this position because we're linemen.
and transitioned into the new program when the Health System took over.
And relax. Good job.
Not so much.
No, you can't sleep in that one.
Working with Roger has doubled or tripled my skill level and my football knowledge.
Yeah, right there.
Roger Allen, the strength and athletic development supervisor,
There you go. Yes,
says
that's
safety and injury prevention are top priorities, especially for young athletes. They work with kids as young as 8 through the age of 21.
KU has a ton of really educated individuals that we can collaborate with, be together. It helps us identify injuries and really help us find ways to train athletes to prevent them from having injuries.
Give me that one more time here.
Layla has already received scholarship offers from more than a half-dozen universities, and she's only a junior. Max is chasing a Division I football opportunity.
See how that made you faster?
Both say this summer program has given them the edge.
It helps a lot having someone look just at you and only try to coach you. Because at school, you're still getting coaching, but the coach has to look at 5 other guys every single rep.
On that right leg.
All my coaches have a specialty so that we can work with a wide range of athletes.
Roger and his team of trainers run programs for youth athletes, helping the next generation not just play, but play smarter, stronger, and safer.
Adductors are your groin muscles.
Smarter, stronger, safer. We are in for a great discussion this morning. Joining me here in the studio is Tyler Sleeper. Tyler, thank you for being here. Tyler is an athletic trainer with the University of Kansas Health System. He's also expecting a call from his wife that could happen truly at any moment because she's 38 weeks pregnant. So you've got you got your phone on, your watch on.
Yep.
And what's the rule? She calls how many times and you know?
2 times.
2 times, you got to go.
I gotta
You know
go.
she's in labor. So hopefully we go smooth, though, for the next 30 minutes.
Hopefully.
Joining us virtually from Surprise, Arizona is Health System orthopedic surgeon Dr. Vincent Key. Dr. Key is also the head team physician for the Kansas City Royals, and he's in Surprise, Arizona for spring training. And finally, joining us live from the Sports Medicine and Performance Center is the Strength and Athletic Development Supervisor, Roger Allen. And Roger is with another one of his high school athletes, Vince Carpiniello. Vince plays baseball at Olathe North. We are so glad everyone could join this morning. Thank you for being here. And Roger, I want to start with you because we just watched that story with athletes Max and Layla. We have some great updates. Max has now signed to play football at KU next year, and Layla is fielding more offers from different college scholarships. That must feel amazing, Roger, having been such a big part of their training.
So with Max, I've trained Max since he was in middle school, so it's been great to be with him throughout his career and as he's grown and developed. And really, really proud of him to get the ability to sign with KU and to stay local and work towards getting on the field.
And in a little bit, we're going to check in with the high school baseball player we have right next to you, Vince. But before we do that, we're going to talk a different kind of baseball. We want to check in with Dr. Vincent Key at spring training. Dr. Key, you're there with the Royals. The Royals, how are the players feeling? Are they pretty exhausted? They've had quite a busy few days.
Yeah, it's been kind of rough, but they're good. Everyone's good. We're in a really good spot. We had quite a few players play in the World Baseball Classic, which they had to get here a little bit earlier and then leave and go with the team, but they went deep into the WBC, and we had obviously Team Venezuela beat the U.S. team, but between those two teams, we had, I think, 6 of our players. Michael Garcia actually was MVP. Salvi was the captain of the the Venezuelan team. So guys were running pretty deep into the WBC.
Such an exciting time. Dr. Key, you work with professional athletes and college athletes across the country. You travel and do surgeries. In fact, we do have video of you treating a baseball player right here in Kansas City, a baseball player from Mid-America Nazarene University. This was very recently. So, Dr. Key, I want to ask you, what are the most common injuries you're seeing now in young athletes?
I think the biggest thing is really we're seeing a lot of overuse injuries. I think a lot of kids, for the most part, are kind of overworked and undertrained, and they have to get to a point where they prepare themselves to do the activity. It's not just doing the activity in and of itself. So we see a lot of overuse injuries, especially in pitchers, where everyone is throw, velocity, spin rate. So that's a lot of the stuff that we see in the office.
And that's the injury that the patient we have video of you treating, Daniel, was a Tommy John injury from throw. When you talk about how the injuries trends are now compared to, say, 20 years ago, why do you think you're seeing those differences?
It's a matter of volume. Kids are playing, they're not playing in the sandlots as much as they're playing every weekend. They may be playing 4, 5, 6 games. And volume is the key. Then you have kids who have a pitching coach. They have their other pitching coach. And again, they're just playing a lot of games. And there's a lot of wear and tear, especially in these pitchers on their elbows. Every time you throw, I call it a click. And you only have so many clicks in the elbow. So I think a lot of it is, again, generalized wear and tear. We don't think of it that way, but throwing is not normal. So there's a lot of stress that's put on the shoulder and the elbow.
I was just talking with Tyler here in the studio about this very topic, with so many more kids doing these intense training programs, specializing in a single sport at younger ages. Tyler, how does that affect your work as a trainer, an athletic trainer?
It certainly makes my job harder, because then I have to deal with all of these overuse injuries, and those aren't quick, easy fixes. That takes time, it takes effort, it takes cooperation with parents, PTs, athletic trainers, and then you have to have an understanding coach that understands that the process isn't a quick process most of the time.
And some of these kids are so young that are coming to you, and they were injured before high school.
Yep. I'm seeing that a lot nowadays.
How does that look when you're having those conversations with parents who might not see what you're seeing on the big the big picture of it.
It can be very frustrating sometimes because parents just want their kid in the lineup. They want them playing. They want them participating. And sometimes that's just not the best for that athlete at the time. They need to, trust the process. And, a lot of the athletic trainers I work with, they know what they're doing. A lot of PTs that I've worked with, they know what they're doing. There's a plan set in place, and we have to stick with it. And, sometimes parents get in the way of that. And it makes it difficult for us to get them back in the lineup and back doing what they love to do.
And when you talk about training properly, and Dr. Key was talking about that, let's go to Roger now, because Roger knows training. Roger, your program starts with kids as young as 8, and you have a way to safely do things at age-appropriate levels. So what does training look like at those younger levels?
So at the younger levels, it's really about just teaching proprioception and body control and awareness. A lot of these kids are growing at a really, really fast rate. And we want to teach them just the fundamentals of movement pattern. People think that learning it and knowing how to move comes naturally, and actually it really doesn't, especially with this younger generation that spends a lot more time in front of the screen than they do outside running and playing. So we're teaching them how to properly run, change direction, jump, land, cut, and do it properly and most effectively. That will improve their overall speed and reaction time, but also keep them healthy.
Such a busy time of year. Today's the first day of spring. We have spring soccer, softball, baseball, track, and so many other sports that are ramping up. So you and your student athlete, Vince, are going to show us some of the common drills that you recommend to prepare all the athletes. So what drill do you want to start with?
So this one's going to be an acceleration drill. What we have Vince set up to is what we call the rip cord. And what's going to do is going to allow me to apply force and resistance to Vince as he's accelerating to the ground. He's going to put a lot of force into the ground. And then after we travel 5 yards, I'm going to release that force, and I'm going to have Vince really focus on bracing his core as he now is instantly released from having a lot of tension to zero tension. Now he's going to apply all that force into the ground and accelerate forward.
Okay, let's see it.
Let's give it a shot. All right, Vince, nice and low, core tight. Ready, go. Drop, 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 go.
And so, Roger, how does that help Vince with his baseball?
So, with baseball, it's not going to be a lot of continuous running. It's a short burst, really, really quick, and have to be very, very reactive. So after he hits the ball, let's say nice little line drive, and he's trying to make it to first and beat the throw, he needs to be able to accelerate from 0 to 60 miles per hour. No, not really 60 miles per hour, but his top speed as fast as possible to I know, right? to beat that throw for that 30-yard dash to first base.
And take us through the next drill. What would be the next one that you like to use with Vince? And is this speed or strength, this next one?
So this next one's going to be strength, and this is going to be more focused to injury prevention and strength. So as we all know, baseball players have to do a lot of rotational things when it comes to throwing and hitting. And most commonly with baseball athletes, they get really, really tight throughout the thoracic spine and very mobile one direction, right? So if they're right-handed or left-handed, they're usually going to be very, very mobile to the right, very, very tight the opposite direction. So this one's to keep him balanced. So Vince is going to take a knee on that blue foam pad. He's going to grab this handle with his right hand. So from here, he's going to reach as far as he can towards his foot, stretching as possible, and then stretching as far as possible, and then he's going to turn and rotate. And usually we're going to do this for lightweight, really focusing on strengthening all the muscles that are involved around the thoracic spine and groin. Then also we're going to do this on the opposite side, so he gets the same amount of rotation and work on the side that he doesn't usually use.
And then for the third drill, what would be the perfect third drill? We're going to make Vince
perfect third drill.
Some questions.
Honestly, the third drill would actually be a little combination of both. So on the third drill will be a little bit of hitting. So now we're going to be a little bit more dynamic. Vince is going to have the handle in his right hand. He's going to rotate and pivot off his back foot and rotate as if he's swinging a baseball. Or swing a baseball bat.
Okay.
All right, ready? Go. Good. Go. Go. Good. And relax.
We're
So
gonna
those are
let Vince-
some of the things, sport-specific things that we do for baseball players.
Okay, so these are Vince-specific, baseball-specific drills. Vince doesn't
Exactly.
look out of breath. He's a pretty good athlete, but we're going to give him a minute to catch his breath. And then, Vince, we're going to come back and ask you just a couple of questions in a few moments. But back to Tyler in our studio here. When an athlete does get injured, how do you manage the coordination between the other trainers, the PTs, the coach, the parents, the school? What does that look like? There are so many layers.
It certainly makes things complex when you add a lot of people into a conversation. Usually it starts with the parents. I'm informing the parent that their athlete was injured and that this is the process we need to take to getting them better. If it requires a referral to a physician, I'm coordinating that with the parents and the hospital. And then judging, depending on when they go see the physician, then I'm speaking to the physician. They usually send them off to a PT. Then my conversation goes with the PT, and then once they're kind of done with that whole process, then they come back to me, and then I'm starting to get them back into the swing of things with getting back in the lineup and practicing and playing games.
I got to tell you, this is so different from when I was in high school.
Yeah.
When I was in high school, you got an injury, and then that was just it.
Yep.
I hurt my shoulders swimming. We were doing 2 days. We did not have training like you're providing now. And basically they said, well, you blew out your shoulders. And that's it. Well, okay, thanks. That's all that happened.
Yeah.
I want to talk to Vince. Vince, are you ready? Ready to talk?
Yes.
All right. So when did you first start training with Roger at the Sports Medicine Performance Center? How long ago?
I think we started about 4 months ago.
What have you learned that has surprised you most that maybe you weren't doing or focusing on before?
Probably how baseball specific the training we were doing, how it applied like straight to the position I play on the baseball field.
And what position do you play?
Outfield.
Okay. And what changes have you made based on what you've learned over the past 4 months to your pregame warm-ups?
I've definitely taken stretching way more seriously before games and practices, and also after.
And we're going to talk about the cool down in a little bit with Tyler. Roger, I want to ask you a question. For athletes that aren't properly trained, how common is it for you to see injuries later that happened during the actual stretching or warm-ups that were done incorrectly?
Yeah, so one of the most important things, like as you mentioned, is for an athlete to be properly warmed up and their body to be fully prepared for the demands of their sport. And so having a warm-up routine that actually is going to help prepare the athlete to perform, and not only that, but especially for baseball players, they spend so much time stagnant, sitting in the dugout, and then all of a sudden they have to go back out and play, or standing out in the outfield, and then all of a sudden have to sprint down a pop fly. They have to have different ways to stay warm so that all of a sudden they don't pull a muscle that got in a little cold. So having a routine and having a regimen based off their sport is really, really important to keep injuries away.
Such a great point. And Dr. Key, I want to talk to you back in Surprise, Arizona. Sometimes it's really hard to tell as a parent how seriously your child is injured because, one, teenagers tend to push through it and ignore it, and then you get a young athlete who wants to just push through it. So for parents watching, how do they know if it's an injury that needs to be checked out by a specialist?
Well, I think there's a difference between playing with pain and playing with injury. And everyone's going to get sore in terms of the things that they do. The question's going to be, how long does it take for that soreness to go away? And I usually go with the adage that, yeah, you can be sore, but it should be gone in about 48 hours. Again, as we ramp up the volume And as I say, at times the veracity of what you do go up from middle school to high school to college, and college to pro. And so these kids have to be ready in prehab. And I think that's a big mantra in our organization with the Kansas City Royals, not only with the Royals, but in college and high school and middle school, is that you have to prehab. And we say you prehab so you don't have to rehab. And it's funny because the same exercises that you would do in the rehab process are the same exercises that you would do in the prehab process.
Oh, interesting.
So it's just starting early. If you're a pitcher, most of the time, in terms of your, getting ready for spring baseball, if you're a pitcher, you should be starting January 1st. If you're a position, so it's about 8 weeks. If you're a position player, it's usually about 6 weeks where you have to start preparing yourself for just the tryouts. And that means stretching. Vince said it as well. It's stretching. A lot of kids don't stretch at all. They think you're going to be able to strengthen your way through everything. You can't. And theoretically, as you get stronger, you get tighter. So theoretically, you can make it worse. And so it's really imperative that these kids really there's 2 tracks. There's the strength track and there's the stretch track. You have to have both.
And the prehab is so key. I haven't heard that term prehab before. The health system also, Dr. Key, has an additional great resource at our Indian Creek location. It's an orthopedic urgent care. How are the services different at an orthopedic urgent care versus a standard urgent care?
Well, I think the big difference is that we deal more with musculoskeletal injuries, and our providers there at the clinics there are more geared towards musculoskeletal injuries. Now, that's not to say that we can't treat any other things, but most of the other urgent cares you're going to get colds and asthma problems and everything else. And so, again, not saying that we can't treat those, but it's more geared towards a musculoskeletal approach. One thing, I want to give Roger a big shout out real quick, because he knows I have a personal stake in him, because he was really critical to my daughter Kaya when she made her transition from high school, where she was running track at Bishop Miege, to LSU, which was the #1 women's program in the country. So he was really, really, really critical to her development. And once she got there, she was actually one of the strongest sprinters and jumpers and hurdlers there. And that was really, Roger was really, really critical in her development. So shout out.
That's such a good compliment. When you get the shout out from Dr. Vince Key, you know you're good, Roger.
That's exactly right. That's high praise.
If you have a question or a comment and you're watching at home that you'd like us to read out loud in the program, just send it to us in the chat feature on YouTube or Facebook, or you can email the Medical News Network. That information is right there on your screen. Roger, when we were seeing that video of Max, who's now going on to play football for KU, how do you tailor your programs for an athlete like Max, who was chasing and achieved his college football dream, versus maybe a kid that comes to you who's having fun and playing sports in grade school or middle school?
So you actually alluded to it. So when you're in grade school, elementary school, middle school, I actually recommend athletes to play multiple sports, usually a different hemisphere of the body, a different focus. So for instance, a great routine will be like playing soccer in the spring, playing football or wrestling in the fall, and then track, baseball, whereas you're working with a sport that's a lower body focus, upper body focus, and then overall total body focus. And then after a while, once the athlete gets up to middle school and high school, that's when they can start to tailor and figure out which sport do they enjoy the most, which sport are they the best at, and then start to specialize in that sport. But you want to have in the very beginning, in the developmental phase, like you want them to be gaining proprioception, mind-body awareness of their entire body and not just one movement pattern. Because if you get locked into that movement pattern super early in life, it's going to be really hard to correct that. And like Dr. Key and like Tyler was mentioning, that's going to start to make that athlete more susceptible to overuse injuries and being underactive in the opposite plane of the body. And we don't want that. And that's part of our job as strength coaches, is to keep athletes balanced and keep them mobile and strong throughout their entire body in all ranges of motion.
Vince, I want to ask you, what's the biggest difference that you've noticed since you started this training? If you had to pick one, would it be speed, strength, or confidence?
I'd probably say all three.
All three.
I've definitely noticed I've gotten faster and stronger since I've joined, and then that's also helped with my confidence. So.
One of the things that we also talk about is the importance of good habits at home. Tyler, we talk about sleep, hydration, rest days. So out of the sleep, hydration, and rest days, what do you see as the most neglected of those three at home?
I would have to put all three on the same playing field.
Really?
Yeah, because these kids, like Roger said before, a lot of these kids are spending a lot more time on screens, so they're staying up later at night instead of going to bed when they should. They're drinking more of these energy drinks and these hydration drinks that aren't really hydrating them. And yeah, it's just, they're not taking the proper rest days when they want to, because they're in sport. A lot of these kids are training 6 out of 7 days a week with their club team, as well as doing stuff at the high school level as well.
What would you recommend? How many rest days should these kids be getting?
I don't think there's any reason a kid should be training more than 5 days a week. I think weekends should be weekends where they actually have a time to shut down.
Yeah.
I mean, not totally shut down, have like an active rest day where they're up moving around. Maybe go spend some time at the pool if it's warm outside, go for a walk around the neighborhood, but not doing anything high intensity that's going to, diminish their returns, so to speak.
I want to get to some of the questions from our community because we've got a question for Dr. Key. Viewer Jamie wants to know, how does she get a second opinion for a teen who's not already a patient at the health system?
Yeah, I think there's a few different ways. Mainly going through our appointment line. If there's a specific physician that you want to see, then I would tell the people at the appointment, on the appointment line, what physician that you would want to see and what the issue is. I know for me, a lot of time, I have 4 kids and all my kids were in sports. A lot of people have my cell number, so they will text me and things of that nature. So, I mean, some of those I just route right to I have a trainer and I have my admin and I have my nurse. So I usually, for those individuals, I just send them right to them. We do have, at least for me, I do have dedicated athlete slots. Because I know that there's going to be some acute issues. There's going to be some questions. I see kids from all over the country. So I truly do have dedicated slots for my athletes. But I think that the biggest thing would be to call our appointment line. If there's a specific physician, ask for that physician, and then you'll be routed to that physician.
We have a question for Roger, and actually we've gotten this in a couple different ways. Jeremy wants to know, how do you modify things when these kids hit their growth spurt? And then we had another question from Louise. She wants to know, how do you modify the workouts? Because every teen develops differently, like their puppies, their feet grow first. So how do you work through that awkward growth spurt from a training perspective?
So yeah, sounds like in both situations, of both questions, we're talking about that preteen puberty phase as they're starting to really grow and like you mentioned, grow different parts of the body at different speeds. So the biggest issue is going to be, once again, I keep saying the same word, trigger word. It's proprioception, means mind-body awareness and understanding their body in space. Imagine getting used to a certain shoe size, and then all of a sudden that shoe size going up 2 or 3 inches. 2 or 3 inches doesn't make that big, sound like a big difference, but honestly, when it comes to running and then getting used to that new shoe size, the new foot size is will make an athlete look uncoordinated and make them move a little bit slower. And it's not until they start to slow down do they start to get used to that brand new body that body that's growing every week, every month. So really, our drills are going to be really focused in mind-body awareness and understanding how to brace and absorb force and redirect force with that body that's ever-changing.
I think if my feet grew 2 to 3 inches over the course of a couple of years, I would definitely notice a change in how I could do things. Yeah. For today's takeaways, Roger, I do want to start with you. How do parents find you?
Oh, so they could call the health system. They could go to our website, the health system website, and look for a search for Sports Performance Center. And then obviously through the doctors, we have a great referral program through athletic trainers and through the doctors. So we all have a way to communicate and send referrals. So yeah. Or just reach out directly to our phone number and it'll get directly to this facility.
And Vince, what advice do you have for athletes that are your age watching?
I would say just make that phone call, come in, see Roger, meet everyone, see the team, and
that's good advice. Make the call. Dr. Key, what's your best advice to make sure these athletes never meet you as a patient?
I don't take that personal. I tell them all the time. I think the biggest thing is, again, is prehab, making sure to get your body ready, whether that's through stretching, through strengthening, and just like I think a few people have said, give these kids some rest. These guys behind me, God made them. You can only make someone up to a certain degree. Let these kids have fun, and then let them learn their bodies, like Roger said. And then, hey, if they're able to get their education paid for, great. But if not, let them at least have the fun of the sport, whatever the sport is.
That's such a great point to go to Tyler on, because Tyler, you talked about how you're trying to get the message home for parents, how to make sure their kids stay healthy. So what's the one thing you want parents to take away from this conversation this morning?
The kids need to take their off-season training seriously. They need to get in the weight room, they need to get stronger, they need to get more flexible. If you add all those components together, you're going to have a well-balanced athlete that will be less likely to get injured.
Thank you for being here. And you haven't gotten a call from your wife yet, so she's not in labor.
Nope.
Just got to hang on a little longer.
Thank
you for taking the time to come down here, and thank you to our entire panel. We really appreciate you. Coming up on Monday morning, what a story. She was shot 3 times at point-blank range, her face shattered, her spine fractured. Doctors weren't sure she would even survive the night, but she did, and here she is. You will hear from this mother and her doctors on how she rebuilt her life.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.